All right, today we are going to talk about the different causes of pain that your chiropractor is going to be trying to determine. And of course, as a chiropractor, the first thing we think about are joints. Let me explain that a moment. When we are thinking about pain in the spine, we're often thinking about, can the joint itself open? Can it extend? Can it flex rather and extend? Can it bend to the side, either side, and can it rotate? And we palpate for those little minute ranges of motion. And if a spine is stuck in those directions, then the chiropractor comes along and adjusts or manipulates that spine exactly in the direction to normalize that mobility. And why is that important? Well, you've got nerves here that are very, very needy of mobility. When you have a joint that's restricted, that nerve can be upset, as well as can many, many tiny little nerves that are traveling from the joints, in this case, the facet joints up to the brain. So motion is lotion. Now, why that is so important, this guy has beautiful disc spaces, nice spaces between the vertebrae. If you ignore your pain and you think, I'm fine, I'm just going to take medication, I'll get along, I'll quit doing whatever it was that caused the pain, and you start to get into a tiny little life, what occurs over time is degeneration. You maybe have heard of disc degeneration, but here's a great example of pretty healthy, starting to wear down, oh shoot, really worn down, and now the disc space is what we call desiccated. Why does that matter? Because the smaller the disc space, the smaller where the nerve exits. It's called stenosis. Not only affects the little nerves that are coming out the side, but it actually can affect the spinal cord traveling down between the vertebrae. Really important that we get you in now at this young, healthy age to prevent this. But the truth is, a lot of my patients come to me in these spaces. So it makes it harder. Get the treatment necessary as soon as you can. It'll create a much better future. Okay, so that's one thing, is joint restriction and nerve pressure. We'll examine your spine for that. And the whole point of it, really, the whole point of that is if you come in and you have beautiful motion as you're bending in all these directions, like, yay, we can celebrate. But if you're stuck like this, no movement, I promise you're going to have discomfort either at the level or below or above the level. And a chiropractor's job is to nudge, open, manipulate very artfully to regain mobility. Okay, that's number one, is joint restriction. Another issue very, very commonly that we also treat are muscles. Now, muscles can do a lot of bad things. Sometimes muscles just get tight. And so you'll see in this illustration a picture of what we call the quadratus lumborum, named after its quadrangular shape. And it lives right through here. And its job is to side bend. And a lot of times we're not getting enough side bending in our life, so that muscle tightens down. Well, if you'll see in the illustration, the muscle's attached to the spine. And then the spine starts to get stiff and upset. And then us going in and lengthening that quadratus lumborum through all forms of different kind of soft tissue work makes a magnificent difference. And then we teach you, of course, how to stretch on top of it. Now, another strange thing that can happen in a muscle is something called a trigger point. And that muscle behaves differently than a tight muscle. A trigger point is actually a little place, and you'll see in this illustration as we look at the gluteus minimus, a muscle here in the gluteal area. You have the gluteus minimus, medius, and maximus. But you can actually see that pain traveling down the leg in red. That pain is coming from that trigger point. And how you treat trigger points is different but similar to treating a stiff muscle. So you've got to go in and know where those trigger points are located, treat them properly, mitigate that referred pain down the leg. And sometimes that can get confused with somebody having, let's say, a herniated disc, and they go in to have surgery, but it's inappropriate to have surgery for something like that. Treat the muscle that's causing the referred pain. Now, another thing a muscle can do is it can turn off. And you think, why? Well, trauma, overstress of any ilk can actually inhibit and turn off the brain's capacity to control the muscle. And sometimes muscles come back on and sometimes they do not. And here's the challenge. Let me give you an example. So let's say somebody traumatized their biceps. They lifted heavier than they thought the box was, let's say, and the biceps got strained and it stopped working. It turned off because the body says, whoa, if I don't let go, I'm gonna pull the muscle or pull the tendon or pull the tendon from the bone. The body has these protective mechanisms. Well, we'll go in and test the muscles and say, wow, that muscle is inhibited. It's not firing, it's not listening to the brain. And then there's some strategies called advanced muscle integration techniques some of our practitioners do in the clinic, where they, through different reflex points around the muscle, you will stimulate that muscle to turn back on. The brain, it's like resetting a computer. The brain goes, oh, I get it. And then the muscle can start working again. So why is that important? Well, muscles cross joints. And if the muscle's not firing, guess what's going to take it in shorts? The joint. Joints like to be controlled by the muscles. They like to be let down easily and contracted slowly. It's kind of like a mother taking a 2-year-old across the street. If she lets go, it's going to be a disaster. The same thing with a muscle. If it's not firing, if it's not listening to the brain, or the brain can't control it, that joint is going to have pain. So you see, muscles can do all kinds of crazy things, and as chiropractors, we got to figure out, is it tight? Does it have a trigger point? Is it not working? Because the brain has turned it off from a previous trauma. Or are you just a person that hasn't exercised for 10 years and we got to get your rear in gear, as my mom used to say. So we then start the rehab. All right, so those are some critical things. Now there's also another tissue called the myofascia. And think about the myofascial tissue as like a big gluey gob of white sticky tissue that goes around every muscle, every bone, every tendon, every ligament. And it kind of looks like a ghost on steroids, if you will. But that myofascial tissue is all throughout the body, and it can get sticky and it can get restricted, and it can cause pain. Let's say the myofascial is stuck here. The person might feel the pain up here. So we have to know when we're touching you, is this a muscle? Is it the myofascia? Is this a joint that's restricted? So those are all the things a chiropractor takes into consideration. Lastly, but on a different category, is nutrition. Look, we can do all these great things to your body, but if you're eating things that continue to give you inflammation, no matter what, you're going to lose the battle. You'll feel better short term, but then the inflammation from the food sources will start to bring the pain back on. So we do counsel you about what you can do to change up how you eat, what you can do to add certain supplements to your diet that reduce inflammation. Super important. And lastly, there's this thing called anxiety and depression. When you have had circumstantial challenges in life and or chronic pain for which you can't figure out, nobody's been able to touch it, medication hasn't helped, physical therapy was short-term, caused short-term improvement, massage felt good for the day, the surgeon doesn't want to cut on you, whatever the case, you're running out of options, and finally you come in and you're going to try a whole new set of treatments through our providers here. Understand that when you've been playing that game of not knowing why, you can get into a depressed state. So we recognize that, and we talk to you about mental health. We talk to you about things that allow you to relax. We might even talk about meditation or an application called Heart Math. But certainly we're going to talk about changing your physiology, having hope again, and recreating a life that allows you to do more and be more. So whether your chiropractor focuses on your spine more, or on your muscles more, or on your food more, it entirely depends upon how you present. So I'm sharing this with you today so you have a bigger, broader depth of understanding of what chiropractors do when you come into our clinic with whatever condition is ailing you. And it is our absolute honor to be able to take care of you and treat you. Thank you so much for your time.